we will discuss lower extremity peripheral nerve syndromes, which involve conditions that affect the nerves in the legs. These syndromes can be caused by different factors such as compression, trauma, blood flow issues, radiation, inflammation, or degeneration. We will go over each of these causes, breaking down what they are and how they might affect the body. Compression is the most common nerve problem in the legs. When nerves are pressed on, it can disrupt their function. This can happen both in the lower parts of the leg or higher up, such as when a herniated disc presses on a spinal nerve. In its early stage, nerve compression might be occasional, like when you sit in certain positions. For example, you might feel numbness along the side of your shin or the top of your foot after crossing your legs. This happens because the fibular nerve gets compressed where it wraps around the fibular bone. If the pressure on the nerve becomes more consistent, it can cause damage to the nerve's protective covering, called demyelination. At this point, symptoms like pain and weakness become more noticeable and persistent. With continued compression, the nerve can eventually start to break down, leading to more severe symptoms. When nerves are compressed, their ability to send signals slow down. You might not notice anything until the signals are completely blocked, which then causes symptoms like numbness or muscle weakness. A nerve transection or neurotmesis is when a nerve is completely cut, often due to trauma, like a knife wound. This type of injury is more severe than compression because the nerve is physically separated. Unlike compression injuries, nerves cannot regrow naturally when they are completely cut without medical intervention. Nerve ischemia or infarction occurs when the nerve loses its blood supply, often due to conditions like vasculitis or severe atherosclerosis. It can also play a role in some nerve problems related to diabetes. When a nerve suffers from an infarction, the blood flow loss leads to damage in the nerve fibers, usually in specific spots. For example, the sciatic nerve in the thigh is a common site for such an injury. Unlike compression injuries where nerve signals slow down, ischemic injury causes the entire nerve segment to break down fairly quickly. However, since the nerve's structure often stays intact, there is potential for recovery once the underlying issue is treated. Exposure to radiation, commonly during cancer treatments, can damage nerves, although symptoms may not appear until years later. While this type of injury is more common in patients treated for breast cancer, it can also affect the nerves in the legs if the pelvis was treated, like in cervical cancer cases. Symptoms include progressive weakness, loss of sensation, and balance issues. Inflammation can cause significant nerve problems in the legs due to different regions. Viruses like herpes simplex, Epstein-Barr, or most commonly the herpes zoster shingles virus can lead to pain, sensory loss, and motor problems. Sometimes the immune system mistakenly attacks the nerve tissues, causing conditions like lumbosacral plexitis. In diabetes, inflammation can contribute to nerve damage, resulting in conditions like diabetic radiculopathy or diabetic amyotrophy. Rarely, inflammation affecting the nerve cells can be related to autoimmune disease like Sjogren's or as a response to cancer. Degeneration refers to the gradual deterioration of nerve cells, which typically starts in the longest nerves and progresses inward. This type of nerve damage is common in many chronic nerve diseases and occurs when the nerves are exposed to metabolic or toxic factors over time. There are also some conditions where the nerve degeneration begins closer to the spine, though this is less common. If the degeneration affects motor nerves specifically, it can cause progressive weakness in entire limb over months, which might indicate a motor neuron disease. Overall, Peripheral nerve syndromes in the lower extremities can arise from various causes, ranging from simple pressure to more complex issues like blood flow problems, infections, and chronic degeneration. The impact on nerves can range from temporary numbness to more severe and permanent problems depending on the nature and extent of the damage.